Welcome to this coffee chat for Human Services Transportation. If you haven't already, please change your Zoom name to your name and your affiliation, if you have an affiliation. As we get started, Matt's going to do a few meeting guidelines, and we'll jump into introductions and get to the meat of the discussion. Take it away, Matt.
Thank you very much, Betsy. So as Betsy has highlighted, if you could please rename yourself to include both your first name, your last name, and your affiliation, should you have one, that would be fantastic. To do this, you can click on the participants button found at the bottom of your screen, and then click on your name, and you'll have a rename option. Feel free to mute and unmute yourself to participate in the discussion today. The chat box will also be open, so feel free to put questions in there. You can also use the raise hand function to speak. You can find this in a few different locations depending on which version of Zoom you have. It may be located right at the bottom of your screen on the bottom bar. It may be within the participants window, which is also found at the bottom of your screen. And it may also be in the chat window by clicking on the three dots. If you are calling in today, you can use *9 to raise your hand. And if you have any technical difficulties, you can get in touch with me, Matt Archer, via the chat box at marcher@ctps.org or by calling 857-702-3708. And with that, I'll throw it back to Betsy.
Thanks, Matt. We're going to take a few minutes to do some introductions real quick so we know who's here. I'll start, and then I'll just go down the list as I see it on my screen in the little Zoom boxes. And I'm Betsy Harvey. My pronouns are she, her, hers. So we're saying our names, our pronouns, our roles, and our municipality or organization or agency that we're representing if we have one. I am going to be facilitating this coffee chat. Sandy normally does, my colleague Sandy Johnston, but he's out of medical procedure and is so I'm going to facilitate right now. Today, and I run the Transportation Equity Program for the Boston Region MPO and do the coordinated Human Services Transportation Plan for the Boston region. And so this is kind of my area of expertise. And I will throw it over to Susan Barrett.
Hi, everyone. My name is Susan Barrett, and I am the transportation manager for the town of Lexington, which in our case involves overseeing the operations for a fixed route bus system, Lexpress, that's been in operation since 1979, and some demand response services, and then things like safe routes to school and other miscellaneous things.
Great, thanks, Susan. Laura Weiner. You're muted.
Hi, sorry. Laura Weiner, Senior Transportation Planner for the town of Watertown.
Great, thank you. If you just come in, we are just doing introductions real quick.
Yeah, I did just come in.
Great, thank you. Franny Osmond.
Hi. I'm still walking the dog for first part of the meeting, so I apologize. I'll be off screen. Franny Osmond, Acton, Mass, and through Crosstown Connect, we have some fixed route and we have on demand, but we have a lot of unmet needs, particularly things like getting home from the ER or going to longer distance medical trips. And we are using the MAPC taxi program and the Making the Connections program and things like that to try to up our game. But we're not quite there yet. And so I'm especially interested in that topic. Thank you.
Great, thanks, Franny. Abby Swain.
Hi, I'm not showing my face. I apologize for that. I live in Brookline and I'm active in the Greater Boston chapter of United Spinal, which represents folks with spinal cord injury and disease. So my interests range among many parts of the Greater Boston area because that's where our members live. They live all over. Members of the association who work on human service transportation related issues have been active in the PT1 arena, and I have been active in partnering with MBTA to try to promote more use of the fixed route system among folks who use wheelchairs and other initiatives.
Great, thanks, Abby. And just so you know, feel free to keep your video on or off. It's up, up to you whether you'd like it on or off. We don't mind either way. Mary Beth Parker.
Hi, I'm Mary Beth Barker. I'm from Concord. My pronouns are she, her, hers. I'm here really as just a citizen, a person with a disability that uses a wheelchair. And so I'm also a member of the Concord's Disability Commission, although I'm not here representing the commission today. I'm just here representing myself. I'm interested in the whole issue of transportation for people with disabilities. So at the same time that it's a personal interest for me, I also just want to listen and gather information that I can bring back to our committee and share with our commission in hopes that it may give us some ideas or avenues for improving the transportation system in the Concord area. For people with disabilities. Thank you.
Thanks, Mary Beth, and welcome. We're glad to have you. Lisa Weber.
Hi, I'm Lisa Weber. I'm the Transportation Compliance and Quality Assurance Coordinator for the Human Service Transportation Office, and we're statewide.
Thanks, Lisa. Karen Dumaine.
Hi, everyone. I'm Karen Dumaine with the Director of Crosstown Connect TMA and the Ponce Valley TMA, Transportation Management Associations.
Great, thanks, Karen. Marissa Jen, I'm going to butcher your last name.
That's okay. That's okay. Hi, everyone. I'm Marissa. My pronouns are she, her, and hers. I'm with the Office of the State Auditor. I'm a policy analyst there. And I'm just, I've been doing research on transit authorities and around the PT1 program and HST. So just looking to have a good conversation.
Thanks, welcome. Rachel Victonbaum.
Hi, everyone. I'm Rachel Victonbaum. You can use she and her. I'm with Mass Mobility, which is a statewide information sharing initiative. I collect information about what transportation options are available around the state for older adults and people with disabilities and others, as well as creative ways that organizations are working to fill in some of those gaps.
Thanks, Rachel. Bill McNulty.
I'm Bill McNulty. I'm a principal transportation planner with Old Colony Planning Council. My pronouns are he, him, his, and I'm just here to just learn and support regional initiatives with Human Services Coordination.
Thanks, Bill. Maria Foster.
Hi, everyone. I'm Maria Foster, she, her, hers. I do transportation resources at the Brookline Council on Aging, so for older adults in the Brookline area.
Great, thanks, Maria. Judy Shanley.
Hi, Judy Shanley. I'm the Easter Seals Director of the FTA-funded National Center for Mobility Management, and she, her are my pronouns. And I'm sorry, I was distracted because I'm dealing with a personal transportation issue with my husband in Framingham right now. But our center is a national center that helps build coordination and mobility management efforts nationally. And I just moved back to Boston recently, so I'm happy to be here.
Great, welcome to Boston, Judy. Thank you. Gail Gilliland.
Hello, can you hear me? I can't tell. I saw a smile, so I think so.
Yep.
I'm Gail Gilliland. I'm I'd be she, her. I live out in Natick. I'm a writer and I've been writing from home for a long time. And after an accident, got rid of the car and found out that I could use the MBTA anywhere I wanted to go. There was a connector service, so even when I got better, didn't replace the car. So I'm very interested in the connector. We have a little bus now that goes up and down my street, and just very grateful for the service and want to see if there's any way I can help keep it the way it is and better it. Thank you.
Thanks, Gail. And Jennifer Glass.
Hi, good afternoon. Jennifer Glass, she, her, hers, Lincoln Select Board, and I'm here to just keep moving up the learning curve as a small town, understanding what our options might be for this kind of transportation, and certainly interested in regional efforts. So, thank you.
Great, welcome. Just going to go real quick to my colleagues at the Boston MPO. Matt Archer.
Hey, I'm Matt Archer, he, him, his. I'm a transportation planner at the Boston Region MPO.
Sandy, if you can
Thanks,
jump
Betsy.
in.
Yeah, I can talk for a little bit. Sandy Johnston, he, him, his. I manage the MPO's Transit Working Group, which is sponsoring the series of coffee chats, among other things. And I'm grateful to my colleagues for taking over facilitation of today's meeting. I had some dental work earlier, and I'm trying to talk as little as I can. So thank you. Looking forward to hearing the conversation.
Thanks, Andy. And Jonathan, I think you're our last one.
Last but not least, hi, I'm Jonathan Church. I'm the manager of MPO activities at CTPS, the Boston MPO, and my pronouns are he, him, his. And I have great staff underneath me who do these coffee chats.
Thanks. If I missed anyone, please jump and let me know. I think I got everybody. All right. Thanks. So I'm going to take like 2 minutes to talk about a little bit to set the table about the transit working group that Sandy leads. I assume that most of you are familiar, or at least have heard of it if you've received an invitation to this coffee chat, but I want to make sure that we're all kind of on the same page about why we're here. So the Boston MPO, which the Metropolitan Planning Organization that all of us, 4 of us on staff work for, has convened a transit working group to help improve coordination among transit providers in the Boston region and represent transit more fully in MPO activities and decisions. General meetings for the group are held about quarterly, and we're also holding these informal coffee chats on specific topics of interest to the membership. And there are a bunch more upcoming. Matt, would you mind throwing some links into the working group in the chat? We'll throw in some links into the chat to help provide you with more information if you're curious about when there are upcoming coffee chats, or if you want to attend the working group meetings, the general working group meetings. The best way to make sure that you're in the loop is to subscribe to emails or to check the webpage regularly. Thank you. Thanks, Matt. And so this particular coffee chat is about, of course, human services transportation. So that's a very big concern and important issue in our region when it comes to transit, and particularly around the coordination of those services among we have 97 municipalities in the region and a lot of different services. And so coordination is, of course, critical to that. So to kind of lay the groundwork, and I apologize, my cat is very vocal and he just woke up and probably waiting for dinner. So if he's meowing in the background, I apologize for that. I'm going to talk for a few minutes about specifically the Coordinated Human Services Transportation Plan, sometimes called the Coordinated Plan, sometimes called the Coordinated Public Transit Human Services Transportation Plan. If you're from FTA, that's their full title for it. I will just call it the Coordinated Plan for ease of conversation. And so as I go, I'm going to throw a couple of links in the chat. So bear with me if I'm talking a little bit slowly as I'm trying to multitask. But to kind of set the stage of what a coordinated plan is. federal transit law requires that any projects that are funded by the Enhanced Mobility for Individuals and individuals with disabilities, you might be familiar with the name 5310 program. Those projects have to be included in a locally developed coordinated public transit human services transportation plan or coordinated plan. And I will just copy and the link to our coordinated plan in the chat so you can take a look at it. And in Massachusetts, MassDOT distributes funding for 5310 grants through a competitive grant program called the Community Transit Grant Program, or CTGP, which you might be familiar with. You may have already, in fact, received a grant for that program. And projects under that 5310 or CTGP grant can be things like shuttle operations, capital improvements, mobility management, travel training, vehicle purchases. There are other options as well, but generally the purpose of it is to provide services, more coordinated services for people with disabilities and older adults in the Boston region. If you want more information about the MassDOT grant, 5310 grant program, there's a link in the chat there as well. Oh, thank you, Rachel. And then I'm also going to throw a link in the chat to the description from the FTA about their 5310 grant program, as details about eligibility and other things that they were looking for and require and the goals of the program. So the goals of a coordinated plan are to identify the transportation needs of individuals with disabilities and older adults and people with low incomes, and provide strategies for meeting those needs and prioritize transportation services for funding and implementation. And it's developed and approved through a process that includes participation from seniors, people with disabilities, representatives of the public, private and nonprofit, transportation and human service providers, and other members of the public that use these transportation services. In Massachusetts, the regional planning organizations, or RPAs, develop the coordinated plan for the region, except in the Boston region where the MPO does that work rather than MAPC, which is our RPA. So if you are in the Boston region, you would want to refer to our coordinated plan if you want to pursue 5310 grant funding. As the name implies, one of the major goals of the coordinated plan is to promote coordination between municipalities, RTAs, and other organizations that provide transit service for people with disabilities and older adults. Specific required elements in the coordinated plan itself include current transportation services, public transit services, an assessment of needs that are missing, so gaps for transit service needs for people with disabilities and seniors. Strategies, actions, or projects to address those gaps, and opportunities to achieve efficiencies in delivery, and priorities for implementation based on available resources, time, and feasibility kind of within the region as a whole. If you're curious to see like the circular, the FTA circular that describes all of the details of the 5310 grant program administration and the development of the coordinated plan, you can check out that link in the chat as well to transit the FTA website. They have an extensive circular with that information. So the coordinated plan is kind of, as it may kind of sound to you, is actually meant specifically for the 5310 grant program. It's in response to the development of that particular program and supports the implementation or the design and development of applications for that program. Now, FTA requires or recommends that development of the coordinated plan is aligned with our MPO's long-range planning process, which is something that we do every 4 years to ensure coordination and consistency between those planning processes. They are quite similar in some ways, in the sense that they both seek out kind of what are the transportation needs in the region and how can we develop new services or programs or investments that meet those needs. And so we do coordinate our coordinated plan with the development of our long range plan. And so it's on a 4-year cycle. And so the next time that we intend to complete both the long range plan and this coordinated plan is in the spring or summer of 2023. So, but work on those and will start before that to provide ample time for public engagement. So this conversation is really good timing for that. So as I think about what in the next upcoming months or in year or so, how to formulate the next coordinated plan so that it is meeting people's needs and is supportive of transportation for seniors and people with disabilities. So it is a federal requirement, but it could be a lot more than that. I think it's really interesting and it's a very actionable document in a way that some plans aren't, or sometimes don't feel that way because they're very kind of long-term or whatever, or kind of high level. This is meant to be very actionable. And so what we're hoping to hear from you today is, well, we're hoping to answer your questions really. Do you want to go to the next slide, Matt? We have some discussion questions based on what folks had heard, some of my colleagues had heard in previous discussions, previous coffee chats with some of you. And we want to hear kind of open-ended discussion of, we can talk about some of these discussion questions, answer any questions that you have about the coordinated plan, kind of whatever we want to figure out, how can we be most helpful and how can we kind of use this group to help inform the next coordinated plan, that development and its final product. So I guess I'll just throw out there if there are any questions about what I've just talked about. If not, we can kind of just start with question 1 and see where the conversation goes.
Hey Betsy, this is Judy Shanley. I asked in the chat whether your plan, you talked about your alignment with the long range plan. Do you also consider any information in the ADA transition plan that might be required regionally?
So we don't do an ADA transition plan. That is, my understanding is that is specifically for organizations that like RTAs and others who we don't design or build or have control over any transportation facilities, whether it's public transit service or capital improvements. So that isn't really specifically a part, at least in terms of, we don't have a coordinate plan, but that could be knowing that other agencies do have to do one. That could certainly, we could certainly look into like, how does that, coordinating those plans and making sure that those, and anything that's kind of highlighted in terms of gaps or needs are also highlighted in the coordinated plan.
Thanks.
You're welcome. Any other questions? Susan?
Hey, thank you. Well, I really appreciate this topic. So just looking at the questions in order. So how can the MPO support stakeholders in meeting the needs and fulfilling the recommendations made in the coordinated plan? So with that one, when I look at the coordinated plan, I think, wow, this has a lot of really great stuff in it. But it also seems like it's a plan and it lives in one place. And I'm never really sure that the funding opportunities are really have, the guidelines really have teeth. Like, yes, we really want you to follow this. And I hope that makes sense. But I feel like if people truly had to go and align with this coordinated plan, we wouldn't be in kind of the mess we're in right now with so many varying transportation services, all run by so many numerous entities without coordination and with so many service gaps. So I think I'd want to find a way to better, like you say, it's an actionable plan, but it feels like an actionable one without a lot of teeth. So a way to kind of marry the funding more to the plan. In terms of identifying needs for the next coordinated plan, I think, there's a lot of great groups that have been doing things. I mean, all of us coming together here, MAPC, I think through their taxi program has been gathering some interesting info. We have some regional coordinating councils and others. You have the Chenaz. I know in our area, they're doing their health needs assessment now. And I think just reaching out to all those various entities from health service agencies, human service agencies, workforce, and just all the other numerous studies we have, compiling that together. The current gaps or challenges, I mean, you'll probably hear that a lot. One of the things I would love to see is a way where we can blend and braid funds. I just had a lovely conversation with Judy Shanley, and I'm glad she's here today. I think there needs to be more attention paid to that. I look at some places, and I do know the grass can always look greener on the other side, and maybe it's not truly, but when I look at places like things like Access Pittsburgh or Ride Connection in Oregon, it feels like their demand response is a little bit more welcoming and maybe a bit more robust. And it seems like they're able to get different funding sources that kind of help it be so, and also seem to be open to people using the service regardless of whatever their particular need may be. They might be a senior, they might be someone with a disability, or they may just not have any other transportation option. So I will leave it at that because I've talked too much, so I'll skip number 4. Thank you.
Oh, thanks. You're right on track with all the questions. Yeah, in terms of the actionability and the teeth that the plan has, I mean, the way that it's written in the federal regs is pretty narrow in the sense that it's, designed specifically for 5310 grant programs. And I don't know how many of you have familiar with them or have applied for them or have seen what they are. It's not a huge list, right, of all the possible human service transportation in the region. Like, it's certainly not everything that's being done. Certainly, the big one that's, rarely, I don't know if they've ever gotten a grant, is MBTA, right? And so if you're going to coordinate services, it has to be more than, you're not going to achieve that necessarily if you limit the coordinated plan to just 5210 grant programs, or in terms of, or those are only kind of projects that have to meet any guidance or in the plan, right? Because you're not going to cover enough services to make it coordinated. So the plan isn't there's not really a way that I am aware of that we can say, like, everybody who gets any transit funding needs to follow the coordinated plan, right? Or to meet any of the needs in it. It's just the people who get 5210 funding. But that's not to say that there couldn't be ways that we can ourselves decide, those people who are doing coordinated, who are doing human service transportation, to in some way commit or try to use the coordinated plan in a more direct, sorry, he's hungry for dinner, in a way that truly supports coordination, right? And is as a document that is meant to cover, like, that is used to cover all municipal. Sorry, I just lost my train of thought. Come on, but 4 o'clock is not a good time for him. That a coordinated plan that other providers are committed to kind of buying into, as it were, beyond just strategic grant programs. So there's not a federal guidance we can say, like, hey, look, we're going to hit you with a stick with this. Like, you need to follow what's in the plan, or meet some of the recommendations, or meet a gap that's in the plan. But, like, maybe as transportation providers, it's saying that we're going to consciously make a commitment to to bind into this with our services and making sure that we are meeting gaps in a way that that's spelled out in the plan. That makes sense. Judy?
I was just commenting that my stomach is making the same noises as your cat. I just, one thing about a coordinated plan, I was working in the state of New Hampshire, and granted this is at a state level, but the Department of Health and Human Services was included in the development of the plan. It's included as a partner in the plan. And what resulted was actual funding. The HHS and CDC is committed funding to support mobility managers around the state. And it was because they were part of the coordinated planning process. And so, think about maybe how you could use the plan to engage audiences that maybe you hadn't thought about before, and then highlight those relationships in meetings that you have, in events, in public forums. And that could be the impetus for them to be more contributing to transportation services.
That's a really great point. Thanks, Judy. Rachel?
Yeah, and just building on what Judy said and sort of what you were saying, Betsy, I think in general, right, it's not just this plan that doesn't say you have, like all transit providers have to follow the plan. It's only the plan, the federal guidance is only for 5310, but that's true in general for coordination. We don't have, coordination is not required. It's always voluntary. And that's why we have to work so hard and creatively to make it happen. And so I think, that's not just for this plan. It's like, how can we use any tool that we have to try to or leverage any tool that we have, maybe beyond its like legal power to get folks excited or interested or willing to come to the table.
Freddie?
Hi. I was wondering how much proactive grant giving there is. Like in the years when I've been working on this, whether we apply, my community or some organization in my community, for a grant depends on if there's some employee or some resident who's a champion of that and sort of pushes it through and comes up with some good idea. And then the grantors get a whole lot of applications, and some are really good. And I wondered if there's an effort to sort of top down look, like this is a really good grant that we gave to XYZ agency or community. Why don't we look and see of all our communities who needs a similar thing? And instead of them taking all the energy to happen to learn about that program and happen to apply for something similar, have you or them say, hey, this is a really good program, so we'd like to put all of our funding to doing this to all the communities and providing to all the communities or populations within that community that need this. Anyway, I was just wondering how much sort of top-down replication there is. Thanks.
I'm not sure. I guess that would be a question for Rail and Transit Division that kind of supervises the administers the program. I don't know if Rachel, you have any other insights into their thinking around that.
I mean, I think traditionally they've been pretty reactive. They have mostly just viewed it as a competitive funding application. From time, I think there is a little bit of possibility for them. It's called taking it off the top if they use the funding for something. So for example, there was from 2014 till 2020, the contract, like expert travel trainers could come and do like workshops on how to offer travel training. I think some of you are familiar with those, and that I believe was funded that way. But yeah, Jenna from Rail and Transit at MassDOT would have all the details, but I think that's an interesting point you make, Franny.
Thanks, Rachel. Any other questions? Any other? Susan?
Yeah, just, additional point on kind of the funding and the coordination. So I was thinking about, how in our area, we're surrounded by communities that have council on aging vans. I think for the most part have been funded through 5310 funds, I believe. And in some cases, like one community only allows seniors, doesn't even allow people with disabilities on their service. And in other cases, it's primarily focused, and I understand why, why it's focused on seniors and people with disabilities, but trying to coordinate becomes very challenging. And when you're doing something, and even, trying to encourage, if they can't really travel a very far distance, trying to encourage them, well, maybe connect to another service to help people get the rest of the distance that you can't possibly do. It just feels like it's very challenging. And so I just, in a way, wish there was a little more top-down pressure to make that happen, rather than it just happening organically. Because I think, like Franny said, sometimes in different communities, you get people who are really jazzed about things and, can devote a lot of attention to them. Other times you don't. And if it's a staff person, the focus might change from, as positions change. If it's volunteers, sometimes you have energy, sometimes you don't. So with something as important as transportation, even though I love grassroots efforts, I sometimes feel we had a little more top-down pressure.
Great, thanks, thanks, Susan. Jennifer?
I'm going to totally support what both Franny and Susan just said about a little pressure from the top. I think about a couple of things. If I'm remembering correctly, wasn't there a bill in the legislature to allow sort of regional funds to be raised for things like transportation initiatives that got shot down by the legislature? Am I remembering that correctly?
Not sure. Is anyone else familiar with that?
Yes, regional ballot initiatives. I believe it's been reintroduced in this session, although I'm not totally positive.
Right.
It's one of those constant things that they're always trying for.
Exactly. So I guess my point being that, is there something that the MPO can help us with, or that we can help the MPO with, in terms of advocating for those kinds of, I know we're talking about grants here, but for those kinds of tools that allow for collaboration, coordination, instead of the model of it's a competitive grant between a bunch of communities. And then, is there ever a coordinated effort? I'm in Lincoln, we have an MBTA stop. We have one of the 24 or so in the state that does not have a high platform to make it accessible, and we've been trying to get the funds released to do that. So, our train line goes right to MGH, but even if you can get a ride to the train station, you still have to climb the steps up into the train. So again, just kind of that, is there some way to tie all these pieces together, so that it's more of a regional, or a more holistic approach across different modes of transportation? Thanks.
Yeah, thanks, Jennifer. I want to make sure that I got some stuff in the chat, and if I missed you, please raise your hand or put it again in the chat. Someone posted about the Massachusetts Ride Match. I think that's a really great resource. If you aren't already familiar, it's just massridematch.org. There's a link in the chat to it. I definitely think it's an important toolbox. It's the only thing that I know of in the state that really has a comprehensive listing of all sorts of different transportation options available for, I think it's pretty much everybody. So that's a really great resource. If I've missed any other questions, just let me know. It's hard to do both at the same time, facilitate and read the chat. Franny?
I just wanted to give an example of the type of thing that I've heard about over the years that would be good to sort of look at and expand if they were successful. Like North Shore having at one point transportation to work. They had some program. If you needed a job access, you could get it. You just contacted them. Cape Cod using taxis for extra time. Greater Attleboro funding their microtransit or organizing their microtransit program with the organizations like the Y or something, with outside organizations. Western Mass sharing vehicles across agencies. Little things like that are the type of thing that I would love to know. Did that work really well? Why did it stop? And could we look to fund it? And if it did work well, make it a wider thing. Anyway, that's this. I just wanted to sort of clarify my thoughts, which I think other people got from what you were talking about. I think you heard me.
Yeah, thanks, Franny. I mean, as everyone's talking about kind of these bigger issues, what's going around in my head is like some of this is almost beyond the specific scope of the coordinated plan, right? And could merit kind of more in-depth conversations and like longer term research or studies. You may or may not know, but the MPO does studies every year, a select number of studies about kind of regional transportation issues. And this sort of thing could, as these coffee chats kind of percolate, as you will, if things come up where we think, oh, maybe this kind of question around what are some of the best practices in coordination, like Franny was saying, for different municipalities and for different types of needs, is there kind of another avenue that we can support beyond the coordinated plan through something like one of our studies that we do, or other programs that we have as an MPO, or technical assistance. We have a really talented group of transit analysts and staff who can assist municipalities with kind of smaller scale transit service projects. So if that's something that that your municipality could benefit from, we can certainly be that source of technical assistance. So just to keep that stuff in the back of your mind, that this isn't the coordinated plan isn't necessarily the only option that we have in terms of thinking about how we can better improve coordination.
Absolutely. Can I add something?
Yep, go ahead.
I just want to appreciate what I heard through Susan Barrett was that the MAPC's next iteration of the taxi program has them putting out an RFP. And that's exactly the type of regional response that's really exciting, because so far the taxi RFP has been different communities making agreements with taxi companies in their areas and keep doing separate things. But if there was that's an example of a top-down thing that's, I think, is exciting.
Thanks, Franny. Rachel?
Yeah, I just wanted to add, Mass Mobility also shares examples of coordination from around the state, but I really appreciate your point, Franny, that there are things that the funder can do to facilitate coordination or make coordination more likely. And I also wanted to just raise a comment from Gail in the chat, just raising the idea of local taxis to and from the train station and the importance of safe street crossings, especially for busy streets.
Hey, thanks, Rachel. Anybody else want to build on those comments, or have any other questions, or want to address any of the discussion questions on the screen?
Betsy, this is Judy again. That's exactly what Rachel just said, is exactly why I asked a question about any content from the ABA transition plan, because you could build the best transit systems and have, inclusive and accessible, high quality service, but if people can't get there, then it's all for naught. And so I encourage you, as you're thinking about your plan, think about inviting those folks who may be responsible for the paths of travel and the sidewalks and the walkways into the process so that those topics are somehow also included in your plan.
Definitely, I will take a closer look at those for sure. Thanks, Judy. Any other comments or questions? Just checking the chat real quick. Yeah, Sandy posted in the chat that link to our it's called a Unified Planning Work Program that lists all the studies. We will be doing, the winter is a time when we come up, when we ask for folks to submit ideas about studies. Studies can come from anybody, doesn't matter who you are, who you work for. And we kind of spend the winter and spring sifting through those, and the board eventually approves funding for about $800,000 worth of studies. So this would be a really good time to think about if there's something that this group wants to propose, or you as an individual or municipality, that we're very, you can email, well, email is probably the best way, I'm sure, and to just let us know what you're thinking. So Abby says, regarding question number 3 about gaps and challenges in human service transportation, about the fact that ride requires 24 hours notice, which is not a lot of time. Yeah, the time issue is something that we've heard a lot of. I think it does sound like, we keep coming back to the fact that the MBTA provides a lot of services for a lot of people in the region, and they might be, perhaps it might be helpful at a future coffee chat to think about if there's someone at MBTA that would be helpful to kind of hear from in a particular division, whether it's someone from the Rail and Transit Division for the 5310 grant program, or anybody from their ADA office or something. Because I don't want to leave these questions kind of hanging because I can't answer them, or our staff isn't quite positioned to address them. But if that's of interest, we can certainly talk about that, or let Sandy or myself know if it would be helpful to have somebody from there to sit on to come to one of these groups, or to the working group and the transit working group in general. Karen?
I thank you so much. Yes, I think it would be very helpful to have somebody from the MBTA come in on something like this for a future discussion. I know that there's a lot of challenges, especially with regard to safety, for anyone, especially coming from a hospital or coming from a medical kind of procedure that may need help and assistance with transportation getting home. They may not necessarily have someone to go with them or to assist them, from a family member perspective, or even a friend that, can assist. And oftentimes, the transportation just, ends at the curb, it's curb service. So what happens to helping and assisting getting people into their homes, and, transportation from an emergency room, transportation from medical procedure, there's just a wide variety of different types of gaps right now that need to be addressed, especially too, not all have wheelchair assist either for people that may need it. Just one of my thoughts.
Yeah, that's a really great point, Karen. Sometimes we just think about, oh, there's service, but does it actually get people to their homes? Or is it not? Because if it doesn't, kind of like what Judy said, if it's not accessible, then it's not useful. Any other, we have about 9 minutes left. Happy to take on a couple of questions, and I want to save a few minutes for next steps. Susan?
If somebody else wants to go, because I've spoken a lot, so I don't know if you have any other hands.
I don't see any others. I assume, Karen, your hand is just left up from earlier.
Okay, well then I'll toss out a wish list item. So I do think it would be great, bring the MBTA into the conversation. As many people have probably experienced and heard, with the ride. I mean, there's just so many people that use the ride, and each ride could take someone, like half a day, right, to get to and from their destination. So I keep thinking, there's got to be a way where we can utilize all these services, from the Council on Aging vans to the numerous agencies that just have their own transportation that sometimes goes a little bit underutilized. Isn't there some way we can bring everybody kind of into, a shared dispatch? I mean, something like what they've done with Crosstown Connect, but that's on a smaller scale, but something a little bit larger, so that maybe we don't necessarily need the MBTA to send out a ride vehicle to go from Lexington to, say, Emerson Hospital. Maybe there's something already in the area operating at about the time someone needs a ride, and we can dispatch that. So I just feel like if we had a larger pool to choose from when sending these demand response rides, would that help with efficiencies, but also closing some of the gaps? And then also making sure, my biggest frustration is with so many of these services, we only are allowing seniors and people with disabilities to use them. And sometimes not even always, like I believe in the case of Concord, where you can't use it if you have a disability, but just making sure anyone who needs a ride, maybe you're just, low income, you don't have a car, there's no transit running, so just finding a way to better utilize what we already have.
Yeah, no, that's a really good point. Yeah, one of the things that comes to mind, just sort of related, is in conversations with folks from schools and high schools and stuff, like they have school buses that are sitting idle for most of the day and are only used during the morning and the afternoon. So it's just an example of underused transportation, but I'm sure it's common elsewhere. Maria?
Hi, sorry, I'm actually going to turn my video off because I'm having internet issues. I just wanted to just echo what a couple of people said. I think we're definitely, as Karen said, seeing like sort of a huge need for supportive transportation. I think the pandemic has fractured a lot of relationships for people. So folks who are living alone are seeing sort of a need to have somebody come and pick them up from medical appointments. So I think that's one thing. And then the other thing is just the pressure from sort of the ride service and having to provide that like sort of last minute transportation option for folks with disabilities who actually get stranded by the ride. And so, I think the idea that Susan mentioned of, is there a way to take pressure off of that system in some way, so that, the folks who really sort of need that wheelchair accessible vehicle, that they're available when they need them, I just think is a good thought.
Yeah, thanks, Maria. I mean, this provides a lot of really good things to think about for the next coordinated plan and some of the key challenges and gaps. Go to Franny, and then I want to kind of have a few minutes to wrap up.
I'm never sure how to do this, but really coordinating with the insurance companies. The examples that I've been listening to recently in Acton include somebody who could have gone to a lab, thought her calcium was low, she wasn't feeling well because of it. The cheapest thing for her to do would be to have gone to the lab, and if it wasn't high, everything's fine. Instead, she thought she should go to the emergency room, and if it was high, she would need to go to the ICU. It would be very important. But she hesitated to go to the emergency room because she didn't know how she'd get home. Anyway, it was a perfect example of the different levels. The best for the insurance industry and for the state, who actually pays her health care, would be for her to be able to have gone to the lab and easily gone to the lab on the Saturday when it was. but instead, often it's the much more expensive approach. So anyway, I have felt too unable to reach out to the insurance companies, but I just would hope that maybe there could be more coordination. And I guess that's sort of what HST does, since you work with Mass Health, but it's on a bigger scale. Thanks.
Yeah, thanks, Franny. That's a really great point. It sounds like, to summarize a few of the points that have been made, is to think in the development of the next coordinated plan is for us to think more broadly about who should be part of the conversation, whether it's insurance providers or folks at the state level, medical providers, healthcare industry, that sort of thing, and to think too about sort of the impacts about some of the impacts that COVID has had, and accessibility, door-to-door accessibility, and some of the gaps that are involved or that are present when you aren't providing that sort of service, and of course regionalization. So one of the things that we'd like to kind of think about is, what are some of the next steps that this group wants to take now that you've heard about more about the coordinated plan? Is there interest in future sessions, coffee chats around the coordinated plan, or some of the issues that we've brought up? We can certainly continue to talk about the coordinated plan. I'm happy to do it. And maybe we can give you people a couple of days to think about it, and we'll send out a feedback survey. And perhaps we can get feedback through that. But if there are any thoughts right now about, we want to continue this conversation, and how can we kind of be most helpful and productive? Well, if you want some time, to think about it, and we can regroup as staff to just kind of think about what we would be most helpful to do for a future human service coffee chat. And we can also think about if we want to bring in someone from MBTA to talk about some of the issues that were brought up. But I think this forum could be really helpful from the coordinated plan side to get input on the kind of some of the needs and framework and things that could be included or expanded on in the plan, and kind of ways that it can be more useful for you all, and for the human services industry and in general. So just a reminder that there are upcoming coffee chats at the Transit Working Group webpage. Bus access to regional rail stations, closing gaps, shortfalls in driver recruitment, and transit recovery from COVID-19. So be sure to register for those if you are interested. And as I mentioned, we will be sending out a feedback survey. I believe it'll go out after all of the chats that are listed on the screen. So perhaps we can kind of get some feedback from you all too, as to what you'd like to see in future coffee chat meetings. Any other closing comments, questions? All right. Well, thank you all so much for being here, and enjoy the rest of this rainy afternoon, and a happy Halloween, and see you in a couple of months, hopefully.